Hello, darlings. I hope everybody's doing well. So, I thought I got bit in my face. There was a bump on my eyelid and underneath my eye, my left eye. And I don't know, but whatever was going on, I started having eczema on my eyelid. Anyway, so I found out some really important information today. Couldn't see my doctor, but I got to see a PA, which is a physician's assistant for those who don't know. And he told me some interesting information. So, a couple of things. If you're going to have surgery, make sure you let your doctor know, or your provider, PA, whoever, nurse practitioner. If you see them before you have surgery, make sure you let them know, because certain medicines you cannot have before surgery. And I found that out today, which I knew some meds you couldn't take, but I didn't know about the steroids. So I asked him for Medrol, which is a steroid, and basically you wean yourself off of it. So whatever allergic reaction, whatever you got going on, your skin's flipping out, whatever it is, you take 7 pills the first day, 6 the next, 5, 4, 3, 2, 1 until you're finished. But thankfully, I told him that I was having surgery on July 23rd and this month, and he said you cannot have a steroid because it interferes with healing and it can leave you open to an infection. I did not know that. I did not know that. So thankfully, he got me on a topical steroid, which isn't going to have the same negative effects prior to surgery. And it's working well already. The itching, boom, gone. Gone. I like it. So I take it 2 times a day for 2 weeks. He said you'll feel better way before the 2-week period. And if you feel like you can stop taking it, then by all means, go ahead. I like him a lot. He's super friendly. You feel like you're going to see a friend. Don't get me wrong. He's professional, but he's so down to earth. He's so chill. Um, we were talking about how you have to take your pain meds. You have a procedure, whatever you have done, you have to take your pain meds on time. And he said his wife had a dental procedure where extensive dental, procedure, and she didn't want to take her medication. I said, well, did she eventually take it? He said, oh yeah. Oh yeah. Uh, you know, that pain hits like a freight train, and trying to get your medicine to combat that pain, well, that's going to be real hard when you haven't been staying on top of it. So what I do, excuse me, what I do is I set my phone alarm for, like, if I'm supposed to take medicine every 4 hours, I take it every 4 hours, even if I'm asleep, especially for the first couple days. If you have to, excuse me, oh, sneezing, coughing, what the heck's going on? Having issues. uh, it's super important that you stay on top of your medicine every 4 hours or every 6 hours, every 8 hours, whatever the medicine calls for. Okay. He also gave me a medicine for anxiety because I'm getting my teeth worked on. Well, it's not like all the extensive work is done, hopefully, knock on wood. And they did a deep cleaning underneath my gums, if you all remember. They give you a whole bunch of shots in your mouth, which, dude, that's not freaking cool, but it's got to be done. And then in a couple of days, I think it's Tuesday or Wednesday, I get a cleaning, which is just a regular cleaning, which is what I wanted before they discovered all these other problems. You know, you need a deep clean and you need to have this cavity filled and you need this and blah, blah, blah. Now that all that's behind me, knock on wood, then all I have to do now, I think Wednesday, Tuesday or Wednesday, I just have to do a regular normal cleaning, which is what my goal was before I realized I had other issues going on. So that's what's going on there. Can't believe July is already here. My surgery's in a couple of weeks, which is bizarre. How did we get here this fast? You know what I'm saying? But I just want to get it over with. It'll be done correctly this time. It'll have screws in there. And he did talk about putting a plate in there. I don't know if that's going to happen or not. But I always had bunions my whole life. And bunions, for those who don't know, is when your big toe leans over in the direction it's not supposed to lean in, and you've got that the more it leans, the more that bone on the side of your big toe sticks out. Mine weren't super prominent, and I didn't give it, half a thought until one day I had stinging pain in my toe, in my foot. And I thought, okay, all right. I get it. You're trying to tell me to go to the doctor. Okay, fine, I will. And then things went left, and here we are. I don't feel nervous. I feel like, don't get me wrong. Just before I go into the ER, or once not the ER, once I go into the ER, I said it again. OR. Let's get hooked on phonics. Okay. Quit laughing, y'all. Once I go into the OR, the nervousness can kind of smack me hard. But prior to that, I've gotten to the point where I've had so many surgeries over a span of a couple of years that I'm more calm because I know it needs to be done. I know it's inevitable. And especially once it's in the OR, it's super inevitable. So then my blood pressure starts skyrocketing and they start freaking out. Now, I always tell y'all, there's nothing to be worried about. There's no reason to be scared. But I get scared. But, and I can't help it. I honestly can't do anything about that. But when they give you the right medication, honey, please. They could tell you, you take this medication, we're going to shoot you through a cannon. You're going to be like a human cannonball, and we're going to shoot you off of the Niagara Falls. You'll be like, okay, cool. You're not going to argue. You don't care. You're not scared no more. Whatever they want to do, it's okay with you. So, yeah. Once they give you the right medicine, you won't care about nothing. And then once they give you Propy, which is propofol, I nicknamed it Propy because I got issues. Once they give you that, it's lights off anyway. Lights off. You don't hear anything. You don't know anything. You don't dream. You are suspended in time and space. And even if your surgery took, let's say it took 2 hours, when you wake up, it feels like it's only been 5 minutes. And sometimes I've heard patients ask their doctor, are we going to do surgery today? They're like, oh yeah, you're all done. But time is weird because it feels like to you, you've only been asleep for 5 minutes. When in reality, you've been out for a lot longer than that, and they monitor you the whole time and make sure that your BP doesn't go high and all this other stuff. So anyways, I'll keep you guys posted. If any weird things happen between now and then, here's another person that they found them their body in the woods or some crazy. I mean, I could write a book on the weirdness, okay? Hopefully there won't be any more of that kind of weirdness at all. Let's just have things go calm and smooth for a change and no weirdness. um, anyway, so you guys take care. Much love. I'll always keep you in the loop and talk to you later. Bye.